We're going to talk a little bit more about the thyroid and some of the thyroid symptoms. I'm just going to go over a few of the symptoms that come from Dr. Broda Barnes' book, Hypothyroidism, The Unsuspected Illness, by Dr. Broda Barnes, the medical doctor. So he studied the thyroid for, as I said, over 20 years and noticed that many of his patients had thyroid trouble before he began to specialize in thyroid problems. And then when he began to specialize in the thyroid problems, he became more and more aware of how prevalent thyroid conditions were in our society. So some of the symptoms he noted were weakness, slow speech. Some of these might be a little bit repetitive, but just to get the idea. Weakness, slow speech, impaired memory, constipation. Does that sound familiar? Because the thyroid gland regulates the rate of metabolism, constipation is a very common finding in people with thyroid dysfunction. Weight gain, pallor of lips, lips that maybe are a little bit too light or purplish or bluish. Swelling of the feet, also known as edema. Hoarseness, loss of appetite, nervousness, deafness, not hearing very well. Poor heart sounds, we've talked about that. Poor vision, changes in the back of the eye, choking sensation, cyanosis, or bluish discoloring of the skin. Oftentimes the upper eyelids have this bluish, kind of purplish tone to them. Difficulty in swallowing, depression, muscle weakness, muscle pain, joint pain, and slowing of mental activity. Okay. So that's what he talks about. In the United States, the occurrence of depression seems to be quite prevalent. It's really sad. Right today, it's 2010, the use of antidepressants has gone up 200% in less than the last 10 years. So, and to repeat, during the last 10 years, the use of antidepressants has doubled in just less than the last 10 years. That is staggering and astonishing. And so they keep giving out these antidepressants, like I've said, Lexapro, Wellbutrin, Methazidone, all these different types of medications, Prozac, and yet they're not identifying what's the nutritional cause of the depression. What's the chemical cause of the depression? What's the emotional cause of the depression? What's the structural cause of the depression? And it boggles my mind that in spite of all that we know about medicine and healthcare and biochemistry and microbiology, that we're not able to help people to get over the depression without needing these drugs that are made in laboratories that have huge, huge side effects. So let's go over a simple biochemical nutritional approach to rid the body of depression forever. I know this sounds overly simple, and it is. I want to make it simple for you so that you get how ironic it is that depression is a treatable, curable thing. If you look at any of the interviews of Jim Carrey, the actor, what you'll find is that he suffered from depression for years, and yet he was able to treat himself with an amino acid called 5-HTP, or 5-hydroxytryptophan, or tryptophan. This amino acid, as you know, is broken down in the stomach. It comes from protein, and so it's a good chance Jim Carrey's stomach's not working right, but the point is that these things are treatable. They're treatable. Okay? So let's go over how to treat them and how simple it really is.